for coming, everyone. My name is Tess Wilson. I am the All of Us Community Engagement Coordinator with the Network of the National Library of Medicine, Middle Atlantic Region. Thank you so much for joining us today. I have a couple housekeeping notes before we begin. Closed captioning is available at the link that I just provided in the chat box. I will be posting it again throughout, so that link should be in the chat whenever you need it. This session is being recorded. It will be available on the NNLM YouTube channel in a few weeks, and I will email that link out to everyone once it's available for viewing. If you have any questions or if you'd just like to chat throughout the session, be sure to chat to all participants so that everyone can see your comment. Participants in this class are eligible for 1 MLA credit and a CHES credit as well. And I will put, you'll be automatically redirected to that link, to that survey link at the end of this WebEx training. It'll take you to that link, but I'll also be putting in the link throughout the session if you need to access it. And finally, your feedback matters. If you would please complete the evaluation at the end of this webinar. Again, it'll automatically link you to it. But that would be great. It helps us improve our trainings, and we're always excited to hear from our attendees. I'll go ahead and get started. So thanks for joining us today for partnering together to support Alzheimer's caregivers in diverse communities. We are really excited to partner with 2 wonderful organizations to present this today. As I said, my name is Tess Wilson. I'll let my other co-hosts introduce themselves. Sarah?
Hi, good afternoon, everyone. My name is Sarah Murphy, and I'm the Vice President for the Programs and Services for the Alzheimer's Association Greater Pennsylvania Chapter, and you will be hearing here shortly about the work that we do with the Alzheimer's Association, and I'm happy to be here with each of you today.
Thanks, Sarah. And Rob?
Hi, I am Rob Lesher, and I am the PA Forward Program Manager with the Pennsylvania Library Association.
Great, thank you all. All right, so a short agenda today. I'm going to give you a little introduction to NNLM and the All of Us research program. Rob's going to talk to us about PA Forward and libraries in Pennsylvania. And then finally, Sarah will talk to us about some Alzheimer's Association resources. So you might be familiar with some of these acronyms that you see on the screen, but it's easy to get a little confused about who exactly we are. So before we really dive into today's workshop, I would like to give you a short introduction to our organization, NNLM. So the National Institutes of Health, NIH, is the nation's leading medical research agency. Many of you might be more familiar with the National Cancer Institute, for example, which is one of the many institutes and centers at NIH. The National Library of Medicine is also an institution at NIH, and it's the world's largest biomedical library, which maintains and makes available a vast print collection and produces electronic information resources like Medline Plus and PubMed. And NNLM is the network of the National Library of Medicine, and that is an outreach program of NLM. And the NNLM is made up of 8 geographic regions. I'm from the Middle Atlantic region, which serves Pennsylvania, New York, New Jersey, and Delaware. And our office is located at the University of Pittsburgh's Health Sciences Library System in sunny Pittsburgh. At NNLM, our mission is to provide equal access to biomedical information to health professionals, as well as access to quality health information for the general public, so they're able to make more informed decisions about their health. And that's why we're so passionate about teaching classes like this one with partners like PA Forward and the Alzheimer's Association. So we do this through resources on our website, funding of projects, in-person trainings, and webinars just like this one. And if your institution isn't a member of the network, I would strongly suggest you consider joining. It's totally free, and once you sign up, you'll receive weekly postings about our resources, trainings, funding, and much more. And today's webinar is brought to you in part by the All of Us Research Program. So the mission of the All of Us Research Program is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for everyone. So the goal of the program is to help researchers understand more about why people get sick and why they stay healthy. So by looking for patterns, researchers can learn more about what affects people's health. And this research program aims to build one of the largest, most diverse data sets of its kind for health research, with 1 million or more volunteers nationwide who will sign up to share their health information over time. So the goals of the All of Us and National Library of Medicine partnership are to increase the capacity of public library and community-based organizations staff to improve health literacy, digital literacy, and participation in scientific research. If you're new to the idea of precision medicine, it's one way that researchers are looking to advance the ability to serve the public health needs of all people. And All of Us is a precision medicine study. But what does that really mean? It's just a new way of looking at health treatment and prevention as being designed for individuals. So this way, doctors can take into account a person's lifestyle, environment, and biological makeup to figure out the best treatment for that individual. And the neat thing is that we already use precision medicine in some ways. You can think about eyeglass prescriptions as a good example. Eye doctors can tell us exactly which lenses will work best for us. But when we visit our regular doctor, they might be more likely to prescribe the treatment or prevention that works well for most people. But we aren't all most people. So when a lot of people pitch in to help with this kind of research program, we build a large national database to help eliminate one-size-fits-all medicine. And one of the great parts about this research is that just about everyone in the U.S. can participate as long as they're over 18. So if you'd like to learn more about this, visit joinallofus.org/NLM for more information. And now I'm going to hand it over to Rob, who'll talk to you about the Pennsylvania Library Association and PA Forward.
Thank you, Tess. If you'd like to move on to the next slide. I would just like to say thank you all for attending here today. I'm going to talk for just a few minutes about PA Forward and partnerships, library partnerships with health educators. So Tess, if you'd like to move on to the next slide. PA Forward is an initiative of the Pennsylvania Library Association. The Pennsylvania Library Association is a membership organization of librarians made up of volunteers with the goal of furthering networking, providing continuing education for librarians, and being an active participant in communicating to our legislature in Pennsylvania about important issues that are facing libraries of all kinds, public, academic, school, and special throughout the Commonwealth. If you want to move on to the next slide, PA Forward is a framework that was developed by the association to communicate what libraries do using a focus on literacy. Literacy is power. Libraries provide the fuel for you, for your community, for Pennsylvania. Kind of the underlying belief is that what libraries attempt to do is to create functioning 21st century Pennsylvanians, and how they intend to do that is that for our citizens to be functioning in a 21st century society, they need to understand, have a working understanding of basic information, civic and social, health, and financial literacy. If you'd like to move on to the next slide, what PA Forward does is create a series of partnerships and educational opportunities for libraries and librarians to communicate and create trainings and programming in their community to try to further that functioning understanding in those 5 literacy areas. If you'd like to move on again, Tess, to the next slide. And what PA Forward does is encourage these partnerships with organizations like the NNLM and the Alzheimer's Association to try to present to their public programs which further an understanding, especially in the area of health literacy. So libraries work with health educators to provide critical information to their communities. These partnerships manifest themselves in a number of different ways throughout the Commonwealth. PA Forward had a partnership with the Alzheimer's Association, and Sarah is going to talk a little bit more about that in a little while. But just a couple of examples that would like to leave you with of these partnerships. Tess, if you'd like to move on. One area where libraries partner with health educators to try to have an impact on our communities is a program called Family Place Libraries. Family Place Libraries focus on early learning and family literacy to try to promote resources and an understanding about what is important as children develop and as families develop. Family Place Libraries usually have a weekly program where they bring in families together to do some kind of active education and play activity. They invite experts in the community in to talk about different topics each week. And it's an amazing place where health educators could work with the library to try to expand whatever specific area that they would like to talk about. These Family Place are throughout the Commonwealth and actually throughout the nation. The Family Place is a national brand, and youth services librarians are trained continuously by this program to try to provide this type of programming. Tess, if you'd like to move on to the next slide. Another interesting partnership is the summer read that occurs in central Pennsylvania. The summer read is, and I'm just going to read a little bit about what the program looks like this year. It says, now in its 8th year, Transforming Health's Summer Read is proud to announce the 2020 selection, which is option B, Facing Adversity, Building Resilience, and Finding Joy, by Cheryl Sandberg and Adam Grant. This powerful, inspiring, practical book focuses on building resilience and moving forward after life's inevitable setbacks. All summer long, readers throughout central Pennsylvania are encouraged to check the book out from their local library and talk about it with friends, family, coworkers, book discussion groups, and beyond. We have more than 80 participating libraries throughout 9 counties. This collaboration is a perfect fit for libraries as a PA Forward Health Literacy Initiative. Karen Hofstetter, Library Liaison for the Summer Read. The goal is to connect our readers to resources that help them take charge of their own and their family's well-being. So the Summer Read program, actually they pick a book each year, but it's based on a different health topic. And then each of the different 80 participating libraries carry out programming within their own institution on some aspect of the topic that the book, sometimes they'll have a book discussion, but other times they will actually bring in health educators specifically to talk about certain topics. In the past, those topics have, in this case, this year, the topic was resiliency. However, in the past, it has involved living wills, it has involved palliative care and making those decisions for families. Also, they have focused on very specific health topics. And these types of programs occur throughout the Commonwealth and throughout the country. It is very easy, in all honesty, for health educators to partner with your libraries, your public libraries, your academic libraries in your communities. librarians are available, and if you're a librarian, it's easy to reach out to one of your health centers within your community to try to find available health educators in your community to do programming within your library. Or if you're a health educator, don't hesitate to reach out to your public library, to your academic libraries, to discuss ways that partnerships, that programming can occur within the facilities. Like I said, Sarah is going to talk a little bit in a minute about some partnerships that PA Forward and libraries within the Commonwealth had with the Alzheimer's Association. But libraries, it is extremely easy, like I said, to reach out to do that. So I'm going to hand over the presentation now to Sarah, who's going to talk a little bit more about specific Alzheimer's programming.
Great, thank you, Rob, and thank you, Tess. Thank you, to PA Forward and NNLM, such a hard acronym to say, for the opportunity to collaborate on today's presentation. As you can see here, we have just some discussion points talking about the impact and prevalence of Alzheimer's and dementia within the United States, but most importantly, the last two pieces on here, talking a little bit about the resources that we have through our organization to help empower you back into your communities to help family members and all of those that are impacted by dementia or other issues, in addition to the fun part of this, which what are some examples of some national and local opportunities to leverage through community partnerships. It's very timely that we're presenting this webinar today in honor of the month of November is National Alzheimer's Disease Awareness Month and Family Caregiver Month, where we look to raise awareness and understanding about Alzheimer's disease in communities. So next slide. So our vision is pretty clear but powerful through the Alzheimer's Association. And I wanted to ensure that, I'm representing today the Pennsylvania chapter. However, nationwide, the Alzheimer's Association has 75 chapters, and we're just representing the one state today. But I always like to start any presentation with our vision statement, as we are the global leader in Alzheimer's science and the leading voluntary health organization, Alzheimer's Care, Support, and Research. And we are committed, every volunteer, every community is committed to our vision with a world without Alzheimer's disease and all other dementia. And through that, we lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. And I will note that just recently we added to the vision statement and all other dementia, because we do know that people are impacted not just with Alzheimer's disease, but other dementias, and we can talk about that just in a few minutes. Next slide. And so, not sure how many of you listening this afternoon have been personally impacted by Alzheimer's disease, but I know I always share that this is something that resonates with me, and I've been with the organization now for 11 years, really out of the commitment that I had to my grandmother, who had vascular dementia, and I've actually had a total now 4 family members who, over the past 25 years, who've been impacted with Alzheimer's or other form of dementia. And so I have seen firsthand the toll that it has taken on my family and within their circle of friends. And one thing I will say is that absolutely an individual cannot do this alone, and hence why I love the work that we do at the Alzheimer's Association to ensure that no family member, no individual feels like they're alone going through this journey. Next slide. So on the slide, for the next couple of minutes, I'm going to talk stats, I'm going to talk about numbers, but this is really to help elevate why this is such an increasing concern in communities, but also why this is really elevated to be such a public health crisis. And so what you see here is each year we publish our annual review of Alzheimer's through numbers called our Facts and Figures Report. So it is a very helpful tool, especially as we visit our legislators to talk to them about the impact of the disease. And this is something that we publish each spring, usually in March. And so we'll look to update this in just a few months. But really just to kind of summarize the importance of why we publish this is we want to elevate, first of all, Alzheimer's disease as a national healthcare priority in communities. We want to urge increased federal funding for Alzheimer's research. And we want to fight for the preservation of strong Medicare and Medicaid programs through some of the statistics that we know. And also, most importantly, develop and enhancing care and support programs for people living with dementia, their families, and caregivers. But we know that, due to COVID, I know we're going to talk a little bit about COVID and its impact. Our report has some data that, does have some important pieces to it that might not be as effective, but we do know that this is such a deeper concern, and especially as we look at some of the statistics here with the growing numbers of Americans living with Alzheimer's disease, and also, too, knowing that the medical profession are starting to see the impact it's having on them and getting the diagnosis or lack of getting the diagnosis. And it's something that, we do like to elevate that, with all professionals and community members. Next slide. So I wanted to pause for a second I know we talk about the terms Alzheimer's disease and the term dementia. I wanted to always, that's the popular question that people ask is what's the difference between the two. And so as you see on this slide, dementia is what we call that umbrella term. And it's almost similar to the term cancer, right? There's many different forms of cancer, pancreatic cancer, breast cancer. Similar to that, there's many different forms of dementia. And so you'll see underneath the different types, and Alzheimer's disease happens to be the most common form of dementia, makes up about 60 to 80% of the cases currently. But we know that dementia is a syndrome. So it's really the group of symptoms that has a number of causes. Some of the characteristics could be memory, which most of you probably associate Alzheimer's disease or dementia with memory loss. It could be language, problem solving, and other cognitive skills that affect a person's ability to perform everyday activities of daily living. And so ultimately these difficulties occur because of nerve cell loss in the brain and parts of the brain that are involved in that cognitive function that has essentially been damaged or destroyed. And we do know that there could be treatable causes of dementia-like symptoms. So we always like to educate in the community, and we'll talk about some programs that we do to educate people what are some potential signs, what are the warning signs that could be what's the difference between normal age-related memory loss versus something more serious like dementia. And we do know that there are some treatable causes of dementia-like symptoms like vitamin deficiency, sleep apnea, depression, and anxiety. And what we say is people might be exhibiting some of the warning signs. The best piece of advice is to actually seek advice of a healthcare professional. And our warning signs and all of our information you can actually find on our website for additional information. And so I'll just hit high level on the 4 different types of dementia that you see underneath the umbrella. Alzheimer's disease, like I said, is the most common type. And it's really characterized by those amyloid plaques and tangles that build up inside the brain, and it affects the area where we do see that short-term memory loss that's affected first. Vascular dementia, that is one that hits home to me. As I mentioned a few minutes ago, my grandmother had this. This is previously caused by, occurs in people who have mini strokes, and estimates to say about 50% of people with Alzheimer's will actually show some signs of infarcts or mini strokes, so obstruction of blood flow to the brain. The other 2 on here are coming more prominent, which is Lewy body dementia and frontotemporal dementia. That impacts a less percentage of individuals in the population, but we do know with Lewy body dementia, it does have Parkinson's-like symptoms, and frontotemporal dementia impacts a less amount of people, but we do know it impacts people younger typically, and memory loss is not typically the first part of the brain that's impacted. It's actually more of the front part of the brain that impacts our language skills. Next slide. And so what we see here is the prevalence is set to rise. And so we look at the numbers here, and I'm not going to go over everything you see on this chart, but what does this mean for our future? And so we see that by 2050, the number of people over the age of 65, so we do know that that's the greatest risk factor, is for someone over the age of 65 to get Alzheimer's disease. And we see that that people over age 65 and older with Alzheimer's dementia is projected to reach 13.8 million people. It's just shy of 6 million now, so that means more than doubling in the next 30 years. So by 2025, just 5 years from now, I think we all will remember 2020, that the number of people age 65 plus with Alzheimer's dementia may reach as many as 7.2 million individuals. And so by 2050, ultimately, we see that with Alzheimer's dementia, over the age of 65 could grow to nearly 14 million people. Next slide. And so what we see here is that just thought this was interesting to show the projected increases between the years of 2020 and 2025 and Alzheimer's and dementia prevalence by state. So you'll see that some areas of our country will be more effective than other regions. And on this map, we can see that the darker shaded areas will expect to nearly see a 30% increase compared to some of the lighter states like Missouri. That could be anywhere from 6 to 12% increase. And really what that's based off of is the aging of their communities and the patterns of moves that help happen to be near retirement. Next slide. And so what we see here is continue the numbers here. And what we do know, what we see is we consider prevalence and growth of dementia in our regions. We also need to continue what will mean for the older population. And so we know that prevalence numbers and diagnosis rates are all often different. And so what we've seen in previous reports, we've learned on that everyone actually gets a diagnosis of dementia, unfortunately. In fact, only about half of caregivers report that they were told by their family doctor that they had a diagnosis of Alzheimer's or other dementia. And that is more pronounced, especially in our rural communities where access to care and getting a diagnosis care can be limited, and especially in our minority populations where there is a noticeable health equity gap. And so that's why there's often a discrepancy with reported deaths from the CDC and the projections based on population. But what we do know, unfortunately, is that it is the 6th leading cause of death in the United States and the 5th leading cause of death for those aged 65 and older and for women at any age. So we do know that the impact is huge. Next slide. And this graph here is what we typically shows the differences, especially when we look at from 2000 to 2018, Alzheimer's deaths increased by 146%. However, and it's probably hard to see here, but at the bottom there, it says, well, deaths from other major diseases remained flat or decreased. And so we are seeing a rise in this, but we see that what we found is effective for those conditions that you can see here, the rates of death from Alzheimer's have continued to skyrocket. And so this graph we like to share with local legislators to see the impact and to show how important it is to continue to help fund and increase awareness and also research dollars towards finding eventually a cure for Alzheimer's disease. Next slide. And so as we look at the impact of Alzheimer's disease and the progression of Alzheimer's disease, we really start to look at who are the individuals that are impacted by Alzheimer's. And so we do see the progression of Alzheimer's disease is very slow and burdensome. I know some people can actually call this almost like the long goodbye. And so what we see here is people aged 65 plus survive an average of 4 to 8 years after a diagnosis, yet some could live as long as 20 years. In fact, my great uncle lived a good 20 years past getting a diagnosis. And so thinking about the impact that that has on that family member, all of those that are providing care, it really does start to put a toll on them. Individuals with Alzheimer's will spend an average of about 40% of their time in dementia in the severe stage. And so what that means is that their care has increased and their ability to do their activities of daily living becomes increased as well. And so the long duration of the disease contributes significantly to the public health impact of Alzheimer's, and again, the cost of the disease and burden on the caregivers. And I think this really helps to illustrate how important it is to provide community education and support for all those impacted so that they will go through this alone. Next slide. So as we look at it, who are the Alzheimer's caregivers? And so as we start to go through this slide, I also want you to think about, as Melanie, my colleague, is going to talk in just a few minutes about our resources and our programs that we have into communities and who would really benefit from this information. And what we do know is that over half of primary caregivers are taking care of their parents. So we know, too, that about a quarter of dementia caregivers are the sandwich generation. So it's those, and I know this all too well, it's those caregivers that are taking care of both their aging parent and they have responsibilities of their children as well, in addition to work and other things. And so 2/3 of caregivers are women. unfortunately, you know, and we think about that, we think about the daughters-in-laws and the sister-in-laws and those people that are taking on that care because no one else will in the family. And so too many times we see that women are taking on that caregiver role. About 1 in 3 caregivers are over the age of 65. So we see that the older the caregiver is, the more difficult and more challenging it can be to take care of their loved one in addition to themselves. And we know the expense and the burden as well. 41% of caregivers have a household income of $50,000 or less. And then also 63% of them, the care recipient, are still living within the community. We do know that getting the long-term care and providing home community-based care can be very costly, and most people are wanting to stay or continue to stay at home when caring for their loved ones. Next slide. And so when we talk about women here at the forefront of this disease, Maria Shriver published in 2010 the Shriver Report. And again, for those librarians and for those of you who really know and have resources, it's one of my favorite resources actually for the association, because it actually captures a compilation of women who have taken on this caregiver role, and you know, people like Nancy Reagan and people who have really been empowered to know that, to fight, and to know that we need to be talking more about Alzheimer's disease as well, and the impact it's having, especially with women. And so what we see of caregivers who provide more than 40 hours per week of care, 73% of them are women, and you can see the difference there, you know, between men and women. And next slide. And one thing I really want to, we talk about, you know, partnering, the title of this presentation is how are we partnering with communities, but especially reaching diverse communities and underserved communities. And so unfortunately, the numbers on the slide here speak for themselves. You know, so in addition to the main risk factor that we know for the general population, Hispanics, African Americans, Black Americans, and women are at higher risk for Alzheimer's disease. We know that Black African Americans are about twice as likely, and Hispanic Latinos are about 1.5 times as likely than whites to have Alzheimer's disease and other dementias. And so what we know is that there's, you know, reasons for these differences is really not well understood, but as researchers are continue to advance in research and clinical trials, we believe that because there are higher rates for vascular dementia or vascular disease like heart disease, diabetes in these groups, and may also put them at greater risk for developing Alzheimer's disease, because we do know that if someone has heart disease or type 2 diabetes or cardiovascular issues, they are at greater risk, unfortunately, for developing Alzheimer's disease later on. And so as we progress in this presentation, it's so important that we are engaging those individuals in these communities that are reflective of these communities to make sure that they know of the resources and information that we have. And the last slide here is talking, the next slide here is talking just very briefly about COVID-19 and dementia. So, you know, have to bring this up. You know, unfortunately, all communities, everyone has been unfortunately been impacted in this pandemic. And what we do know is that COVID-19 and dementia does not increase one's risk for COVID-19. In fact, most likely dementia does not increase the risk. The respiratory illness caused by the new coronavirus, just like dementia, does not increase risk for the flu. However, dementia-related behaviors like increase of age, common health conditions, and other accompanied dementia may increase risk. So a really good example is if someone with Alzheimer's disease and other dementia may forget to wash their hands or take recommended precautions to prevent the illness. In addition, diseases like COVID-19 and the flu may worsen cognitive impairment due to dementia. And so we also see, unfortunately, an increase of health disparities within the diverse communities I outlined on the last slide has also been illuminated since COVID as well. And even intergenerational families, like diverse communities, are seeing an increase in confusion with their loved one, and also whether they were formally diagnosed or not. And so that's why the importance of understanding the warning signs is even more extremely important more than ever. And so as we continue with the presentation, we certainly are going to highlight some resources that we have specifically for COVID-19 for caregivers who are caring for someone in the home, in addition to professionals that are providing care within the long-term care setting for those impacted by Alzheimer's and dementia. And so I will go to the next slide, and I believe my colleague, Melanie Smith, is going to be talking about the resources that we have for the Alzheimer's Association.
Thanks, Sarah. I appreciate it. The Alzheimer's Association offers a number of resources online and via phone wherever caregivers are most comfortable accessing information when they need it most. This includes our virtual library, which provides information, materials, and services on Alzheimer's and dementia to the general public and researchers. This includes resource lists, which are developed based on frequently requested topics and a selection of the best websites related to Alzheimer's disease, jump starters, which provide full text articles to jumpstart a research paper, a presentation, a grant proposal, and to learn more about Alzheimer's disease, as well as popular searches. Families and professionals often ask for a short list or a few good resources on certain topics. These popular searches are 1 to 2 pages in length, and they're for anyone looking for practical hands-on resources related to specific care issues. Next slide, please. Our 24/7 helpline, which is 800-272-3900, is available around the clock, 365 days a year. No one should face Alzheimer's alone, and through this free service, specialists and master's level clinicians offer confidential support and information to people living with the disease, caregivers, families, and the public. You can learn about the symptoms of Alzheimer's and other dementias, find out about local programs and services, get information about legal, financial, and care decisions, as well as treatment options for managing symptoms. You can also receive help from our bilingual staff or translation service, which accommodates more than 200 languages. And you can access support through our TTY service if assistance is required via a teletype device. Next slide, please. We offer a robust curriculum of education programs, and these can be accessed 24/7 through our website at alz.org, and also virtually at each chapter where programs are delivered locally by our trained volunteers. These programs cover dozens of topics, including care strategies and Alzheimer's basics. This is a partial list. We also have a very popular Healthy Living for Your Brain and Body that focuses on prevention, as well as programs focused on the Alzheimer's continuum, including Living with Alzheimer's for care partners early, middle, and late stages. Here in Pennsylvania, we have many programs on our schedule for November and December, including a November 12th Caregiver Symposium that's focused on balancing care challenges. This important program and others that we will hold in the future offer opportunities to connect with professionals who are experts on caregiver topics and learning opportunities to enhance caregiver skills, and also opportunities to learn about practical care issues and stress management techniques. Next slide, please. Pulse Connected is our very active online community where we connect people across the globe. These online message boards allow caregivers and individuals living with the disease to connect with others to share thoughts, questions, and ideas, and to learn from others with similar experiences 24 hours a day. You can browse through forums without creating a profile, and you can also create a profile, post online, and contribute to the community. Pulse Connected offers a platform of support without a formal group, and our online community is ready to answer your questions and give everyone support. Next slide, please. Alzheimer's Navigator is our free online tool, and it helps those facing the disease to determine their needs and develop an individualized action plan. This online tool guides caregivers with questions and answers, and through this process, a personalized action plan is developed, including links to information, support, and local support and resources. Next slide, please. The Alzheimer's Association and AARP Community Resource Finder connects caregivers to a variety of local resources by simply entering a zip code. The database includes listings for a wide range of services, including housing options, adult daycare, home care, medical services, legal services, and other community resources. Chapter programs and registration for programs like the ones that I referenced can also be accessed through the Community Resource Finder, in addition to our 24/7 helpline. Next slide, please. As we all know, science moves fast, and you can stay up to speed with our Alzheimer's Association Science Hub app. This free app provides the latest news, information, and expert views about Alzheimer's and dementia research at your fingertips. It's dedicated to the rapidly evolving Alzheimer's and dementia science, and you can read research and news from the association and other credible resources. You can also access our grant programs, grant summaries, and journals. To learn more about the app, you can visit ald.org/Science Hub. And Sarah, I'll let you take it off next.
Yes, thank you, Melanie. A lot of really great, as you noticed, a lot of online resources, which, as you can imagine, is even more impactful and helpful during the times we're in. But I highly encourage, as we talk about the impact of just referring patrons coming into your library or people that you work with, knowing that we have a 24/7 helpline through the Alzheimer's Association can make the world of difference. And so, and I will say the Science Hub app is something that I have downloaded on my phone, and with the increased awareness of Alzheimer's disease, as we talked about the numbers and the impact that it's having on communities, people want to be empowered and they want to find hope as well regarding where are we with hopefully one day finding a cure to Alzheimer's disease. And there's a lot of fascinating, up-to-date information regarding research on our Science Hub app. And so I encourage each of you to download it and to make sure that you share it to anyone who might find that helpful and interesting. So the last section of our presentation is really to talk about, we talked about the impact of Alzheimer's disease, talked about some of the resources that we have on our national level, but wanted to spotlight a couple of partnerships that we have done in Pennsylvania that hopefully will be an example of how we would like to reach and connect with people. So we do know that, unfortunately, Alzheimer's disease is impacting so many people, and a part of our mission statement is we want to reach new audiences and to impact people all affected by this disease. And so in order to increase our partnerships, we know that we can't just do it alone with the staff and the volunteers we have. We have to be able to increase our reach to new audiences and communities so that we can make that greater impact. But we also know that we cannot understand fully what a community needs without actually listening and convening people within that community to get a clear understanding of the needs of that community, the challenges, and what are the opportunities. And so we want to make sure that, Melanie went over some of our general education programs that we offer for the Alzheimer's Association, anywhere from the basics of Alzheimer's disease to understanding the warning signs, to risk reduction, to really in-depth caregiving programs. And so we want to make sure that we are reaching individuals through our programming and education. And so an example of how we've actually leveraged educators is actually through the Pennsylvania Cooperative Extension. So as you know, a part of what they do a fantastic job at reaching and connecting within the rural communities, especially that they have offices in, to provide quality health education on a variety of topics. And we recently, or actually over the past year, we entered an agreement with them where they actually have trained about 25 to 30 of their educators that go out into the community and provide health education to help better inform the communities on making the best decisions. And I think when Tess spoke earlier and Rob, and we talk about kind of the vision and the impact that they want to make, it aligns. And similar to the Cooperative Extension, they wanted to make sure that they provided the best quality health information to their constituents and their communities. And so we trained them and gave them access to 3 of our educational programs and curriculum. And that empowered and gave them the opportunity to provide these educational programs. They had access to the curriculum at their fingertips to provide it into their communities. And it's really exciting to see some of the impact that they've made just over the past year. They've actually helped us to reach almost 1,000 new people in over 20 different counties. And if it wasn't throughout that partnership, we would not have made that impact without them. And so I just think that highlights an example of how we've leveraged and aligned goals of an organization to help us reach new people with information. And so, in addition, the importance and the impact of connecting with diverse audiences at greater risk and address health equity. And so being able to connect with diverse organizations and community members to help elevate this is a huge goal of ours, and always looking to help to bring awareness about that. So last snapshot and example is our buddy Rob over at PA Forward. He did a fantastic job at the beginning of this presentation talking about some of the examples of partnerships that they value, in their communities. And I was fortunate enough to be able to work with PA Forward probably about 2 years ago. We were known as a resource partner, a statewide resource partner with PA Forward, the initiative of the Pennsylvania Library Association. And what we did is we convened 6 different library locations, some of our general consumer education programming that we had talked about earlier, and we launched our partnership into ensuring that we are wanting to connect with libraries across the Commonwealth to empower them to be hosts and to provide some of our educational programming, free of charge, at no charge. And so we were able to connect to new audiences through the library system. So not only did they host some of our educational programs, but the libraries also were able to provide our resources, within the libraries themselves, in addition to hosting support groups. So Melanie talked about not just our educational programs, but also the opportunity to convene individuals going through this disease, to work with others. And so I'm really proud of the work I think that we've done and worked with libraries, because we know libraries, are meeting and reaching people through their community base. And so we've done a really great job, I think, and continue to explore opportunities to make sure we continue to work with PA Forward. In addition to, we provided an updated list of resources specifically to Alzheimer's, dementia, and caregiving to libraries so that they had access to the latest information and recommendations from the Alzheimer's Association, so that we know it gets in the hands of patrons that are visiting the libraries. And so with COVID, we have to halt some of our external programming. As Melanie had mentioned, all of our information is virtual, but opportunities to continue to engage with libraries and provide adult programming and provide the much needed resources. We have the information and resources and would love to connect with libraries throughout the Commonwealth and other places as well. And so, Rob, I will pass it on to you if you had anything you wanted to share regarding the partnership or feedback, and if not, I will certainly pass it on to Melanie.
I would just really like to say that it was a really amazing partnership between the libraries and the Alzheimer's Association. As Sarah pointed out, most libraries have spaces where educational programs can be carried out, and many libraries work in partnership with each other to be able to carry out these kinds of programs. So even if as you reach out, the very closest library may not be able to accommodate the meeting, libraries work in partnership with that. So this partnership with the Alzheimer's Association really got the word out into a large number of regions in Pennsylvania about the health education that's involved with it. Plus, with PA Forward initiatives, it really helped move forward on that education. So thank you, Sarah, and the Alzheimer's Association, and I'll let you move on.
Yeah, thanks, Rob. And one last thing I will say, I forgot to mention that, through the partnership, we also were able to meet other partners with PA Forward and introduce our information to them. So it was actually really nice to be able to even leverage the partnerships, that PA Forward had and introducing them to the Alzheimer's Association. So it's all about that collective impact and working together. So yeah, looking forward to continuing our reach as well, and appreciate Rob and everyone at PA Forward for the opportunities and the ones to come. And now I'm going to pass it over to end here with Melanie.
Thanks, Sarah. As noted, our helpline referrals really are a great way for libraries to partner with us. It's an opportunity to leverage all of the information and resources that we provided in this presentation for you today in terms of referring your patrons and anyone in the public to our helpline number. It's really our gateway to all of our programs and services, and they can then, in turn, refer at the local level to any programs, services that are locally delivered as well, in addition to those that are available nationally. And also, it's just a great way to connect others. We find that Helpline is a common resource for people, that they use it over and over again. So it's not necessarily to be viewed as a one-time opportunity. Please do consider it as an ongoing resource. It is 24/7, and we do know that people access it actually 24/7. So thank you so much for this opportunity. It's really been a tremendous pleasure and honor for us to be here today with you. Thank you for your time and interest. And I think we're now going to open up to some questions.
Yeah, thank you all so much. That was so wonderful. And thank you, Sarah and Melanie. Those resources are so valuable. I'm so happy that you were able to bring all those to our attention. I've also added, there's a PDF of some resources that the association put together. They're available actually on the NNLM page where you registered for this course, but I've also put them in the chat. So those are available for you to download if you'd like. We did have one question. If anyone has questions, please put them in the chat, and I'll be sure to read them out. One question was, are the materials for extension available to other states?
Oh, I love that question and appreciate that. So we actually, fair to mention, so we have a partnership statewide with Pennsylvania Cooperative Extension, but we just signed a national partnership, or will be soon, so that the guidance is if there is interest, for other extensions, kind of two-part answer here, that want to learn more about accessing and how to be trained on our information, we can certainly do that because we have a well-oiled machine here in Pennsylvania. But the 11 to 13 different educational programs that we actually have curriculums for, we do have a what we call an Alzheimer's Association Community Educator Training Program. It's a long title. So we actually have the opportunities that if individuals or groups are interested in being trained and learning how to deliver some of our educational programs into the community, certainly can connect with the Alzheimer's Association wherever you are. So the best way to do that is actually through the 24/7 helpline or visit the alz.org website to find a local chapter near you and connect with them about, learning more on how to access some of the curriculum and what that looks like. But our tools and information that we had provided to Extension is available to those who are interested in providing that into their communities, absolutely.
That's great, thank you. We also had another question. Is the PA Alzheimer's Association available for Zoom presentations for public libraries given COVID limitations?
Amen, we are. We are waiting for it. No, we actually, it's exciting. I think tomorrow, I just happen to live in Mount Lebanon, like if anyone knows, in the Pittsburgh area. And one of our community educators is doing a program for them via Zoom. So yes, absolutely. We are looking for venues, quote unquote, virtual opportunities to have our programming. So yes, absolutely.
Great.
Everything we do is virtual right now.
That's great. If anyone has any other questions, like I said, you can pop them in the chat. We have about 5 minutes left, and our email addresses are here on this slide. If you'd like to email any of us with questions, I'm happy to answer questions about NNLM and about joining the network. And I'm sure any of us would be more than willing to chat about any questions you might have.
And I will say too, any questions you might have, our email addresses are on there too directly, but definitely encourage our website and our 1-800 number as well.
And I put in a link to that survey. Like I said, when you close out of this WebEx training window, it should automatically redirect you to the survey link to receive CHES credit. This survey link is actually in the chat as well. And you can either get CHES credit, or if you are not in the market for CHES credit, you can get an MLA credit as well, and that'll take you to both of those links. We'll stick around for about 5 more minutes if anyone has any last-minute questions, but I just want to thank you all so much. This was wonderful. This was so full of good information. I hope everyone enjoyed it, and if you have any questions about the survey link or anything else about an NLM, let us know. Thank you so much.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.